My speech is on chronic fatigue syndrome. The definition of chronic fatigue syndrome, CFS, is a complicated disorder characterized by extreme fatigue that can't be explained by any underlying medical condition. The fatigue may worsen with physical or mental activity, but doesn't improve with rest. This is according to the MayoClinic.com health website. Many doctors have been baffled all over the world in finding out how this disease is brought on and what is the cure for it. Some of the major roles developing the CFS, the chronic fatigue syndrome, is age. It usually shows up in women more than men between the ages of 30 and 50, but this is also a factor that women will go to the doctor more quickly than most men do. So it is still a mystery that this is the correct data. It has affected many teens, but is very uncommon with them. Previous stress and environmental factors, such as heat and a lot of sunlight, or cooler temps and dreary days, have affected this. So good luck on trying to figure out where to live. Genetics and previous illnesses also play a huge role in the development of the chronic fatigue syndrome. Your immune system could be out of whack from your other illnesses. Symptoms of the CFS are similar to those of the flu and other common viral infections. The main symptom of CFS is extreme tiredness, which is new, not your normal, I'm tired, I don't feel good. And it isn't relieved by bed rest and keeps you from participating in your normal everyday activities. Some other symptoms include feeling extremely tired for more than 24 hours after your normal exercise activity that is considered easy, such as walking. Feeling unrefreshed after sleeping for your normal amount of time. The forgetfulness. Yes, we all have forgetfulness, but you know what I mean. Being able to concentrate, confusion with your everyday tasks, and joint pain, but there's no swelling or redness. You might have headaches that are different from what you normally have had in the past, and you might be irritable, more so. You might have sore throats and mild fevers. It's usually around 101 temp or less. Some of the testings that doctors have done to rule out other diseases are heart, liver, kidney. They have looked at immune disorders and muscle or nerve diseases also. As you have heard, there are many tests that need to be done in order to try to figure out what is wrong and get the correct prognosis. Sometimes doctors have found that people that have been diagnosed with CFS have had abnormal brain MRIs, and their white blood count has been off also. There is no cure today for chronic fatigue syndrome. The goal for doctors is to help relieve symptoms and allow these individuals to lead a somewhat normal life. Some treatments have included a combination of healthier diets, sleep management techniques, medications for anxiety, depression, and for reducing pain, discomfort, and for fevers. As stated before, there isn't a timetable on this disease. It may be for a short time and back to normal life activities, or could affect them for the rest of their life. I chose this speech topic because my uncle has chronic fatigue syndrome. He was going to be here today for my visual aid, but with all the heat that we've had, he didn't feel he was up for the drive from La Crosse with my cousin. So I apologize, but I do have a picture of him. I don't know if you can see. Whoa. Okay, that's him right there. As if you could see very well with that picture, he is young, and he's not much older than I am, actually. And he had to quit his job that he absolutely loved. He has gone to numerous doctors and in different states too. He has moved from the Madison area to a suburb in Las Vegas to see if the climate would help his condition. This spring he has moved back and he still battles with this disease, as he's not here today. Doctors have shared with him that it is a very complicated disorder and the process is slow, but he has remained in good spirits and doesn't seem to be too much different than his normal self, except that he has to stay indoors and he needs lots of rest.